Today, what we will be doing is hearing from two distinguished colleagues in the medical and health world who will cover a timely topic that is front of mind for all of us. We are so grateful that in launching this year and in being able to mobilize ourselves and move forward with intention, that we have the opportunity to hear from two specialists today. And thank you so much for being with us. We have both Mark Pfister, who is the Executive Director of Lake County Health Department and Community Health Center. And we also have Dr. Jeffrey Kopin, who is the Senior VP and Chief Medical Officer for Northwestern Medicine Lake Forest Hospital. So gentlemen, thank you both. And let me just tell you a little bit about our guests before I turn over the presentation to them. Mark Pfister is the Executive Director of the Lake County Health Department and has been such since 2017. He has been a public health executive and ecologist for over 30 years. And his work has included research with both organisms and humans and the identification of aspects of health and balance that includes the impact of socioeconomic environments within our ecosystem. Dr. Kopin, as Senior VP and Chief Medical Officer at Northwestern, is also a practicing internal medicine physician who serves in his functions with the hospital system and also is responsible for the clinical management for all Northwestern medical locations north of the city of Chicago. Dr. Kopin is a longtime faculty member of Northwestern University's Feinberg School of Business. I wanted to tell all of the attendees, and we have well over 100 of them, I know. I wanted to tell you all that we're so grateful to have you here. And a little bit of housekeeping. Please be sure to look at the very bottom of your screen where you will see Q&A. Enter your questions. They will be entertained by Dr. Kopin and Mark at the very end of their presentation. I want you to take a look at the Q&A or hit the Q&A button at the bottom of your screen, type in your questions, and then we will ask them at the very end of the presentation today. So without any further ado, what I would like to do is share a screen and be able to start a presentation.
Thank you, Joanna. My name is Mark Pfister, as she said, the Executive Director at the Lake County Health Department. It's a pleasure to be here today with you all in Lake Bluff and Lake Forest. And so the title of my slide today is, Will COVID-19 Become Endemic in 2022? And so I also want to talk just briefly about some things that we need to take future action before our next pandemic. I know we're still in the current pandemic, and the good news is Omicron is in the decline. We are seeing cases drop, and we are seeing hospitalizations drop, and we are seeing deaths drop. So that is good news. However, endemic, as you'll see briefly, does not mean that it's over. So I just want to do a few statistics right now where we're at in Lake County. So we have over 112,000 confirmed cases. Unfortunately, we've had 1,209 deaths. And 86% of those deaths have been in individuals ages 60 and older. And many of those individuals in that age group also had other underlying health conditions that led them to, unfortunately, die. Also, 762 of those deaths actually occurred in 2020. And in 2021, we had 388 deaths. So that was a 50% change in reduction. And I'll speak to why that happened. Right now, our case rate is still through the roof. We are having over 1,000 individuals per 100,000. So that's per week case rate. And then our positivity has gone down. But I also want to caution everyone here that positivity right now, that metric is actually being influenced by the fact that there are so many home tests now available, and home tests are not accounted in that positivity rate. And just to talk about where we're at, with regard to vaccination statistics in Lake County. So Lake County has done exceptionally well, and certainly Lake Bluff, Lake Forest, Highland Park, Deerfield. These are locations in our county that have exceptional vaccination rates. We've had over 1.2 million doses administered now in Lake County. 66% of our population is fully vaccinated. And I'm not going to go through all the age groups, but you can see 65 plus is very strong, showing with the number vaccinated and fully vaccinated. But where we're seeing some weaknesses still is in the 5 to 11-year-olds. And so we had a really big upshot in that group. So about 30% of them got fully vaccinated very quickly, which actually followed a national poll. But the last couple of weeks, that's been declining. So we really need to work on that 5 to 11. And then if we look at for those eligible for vaccinations, which is 5 years and above, that we are 79% fully vaccinated, and we're number 2 in the state of Illinois. So I just want to talk real quickly about what does it mean to be endemic versus pandemic. There's been a lot out in the media, and I think people are reading what endemic means differently. And so pandemic, let's just talk about that. Pan in Greek means all, endemic or demos in Greek means people. So pandemic means all people, or that there was a sudden spread across multiple countries affecting many people. And so most recently we had the same situation in 2009 with H1N1. But endemic disease just means that it's constantly present in a population within a particular region. So an example of endemic infectious disease and a communicable one is influenza, is that every year influenza continues to circulate. And I think there was some statements early on in COVID-19 that we were going to eradicate it. And so influenza is something that we have never been able to eradicate. We have been lucky, for example, with smallpox, that the last human case of smallpox was in 1977. So that was a type of disease, an infectious disease that we've been able to eradicate. But many infectious diseases become endemic, and that's what we're talking about with COVID-19. So if I just look at some other endemic diseases that are out there, influenza, as an example, we have about 1 billion cases every year worldwide. In the United States, we have about 15 to 52,000 deaths on an annual basis for influenza. Obviously, we're lucky that malaria is not circulating in great numbers in the United States. HIV, we have treatments and other things now that have really benefited us. Measles picks up, especially in areas where there's lower vaccination rates. And then tuberculosis, we've really done a good job here in the United States. This last year in Lake County, we only had 10 active cases of tuberculosis. So that's great news. And then cholera, that's something that was really a big problem back when we didn't have clean drinking water. I also want to just talk about another concept known as herd immunity, because this is important for some other slides, is that, you've probably heard that herd immunity, Dr. Fauci originally said that we need about 60% herd immunity so that we could achieve enough people that had built some immunity that they were no longer susceptible to COVID-19. And so you see another thing on this slide, the basic reproduction number. It's like how many individuals can be infected by one person that we're looking at. So measles, for example, one person can infect a lot of people very quickly because it's so infectious. And so when we look down at the bottom of that slide, you see the original strain of SARS-CoV-2 or COVID-19 is that we needed about a 60% herd immunity. Our goal here in Lake County actually was an 80% goal of herd immunity. And that could either be by vaccination or by becoming infected, having some natural immunity. And so in the next slide, next to the original, is the Delta variant. And you could see that it was more infectious and had a higher reproductive number, is that we needed about an 85% herd immunity to really reduce the number of susceptible people. But Omicron came along and it's different in a lot of ways, is that it's more in the upper respiratory tract. So that is even more infectious. And so we needed about a 90% herd immunity achieved for our population. So one thing I wanted to start off with and just say, COVID-19 vaccinations are a success. And that has been proved in many ways. And I just want to say that, our federal government really did a tremendous job working with, and you're going to see this a lot in my slides, we need to continue building more public and private partnerships to be successful in future pandemics. And so this was a great public-private partnership. The federal government was pushing dollars to private firms, pharmaceuticals, Pfister, Moderna, et cetera, to really build and quickly build our COVID-19 vaccines. And now, while they were quickly built because of all those efforts, that safety was not minimized. And in fact, the Johnson & Johnson, that methodology of vaccine has been worked on since the 70s. And actually the mRNA vaccines have been worked on since the 90s. So a lot of people got bad information that these were brand new technologies, new. What happened is that there was a lot of R&D that went into these very quickly and brought them to market. So that was very positive. Another thing about this is really to continue prioritizing efforts to improve these vaccines, because we think, just like influenza, we'll probably need an annual vaccine for some time for the coronavirus, the SARS-CoV viruses. And so we also need to increase the supply of pharmaceutical treatments. We do have a few new antivirals on the market. There has been some monoclonal antibodies that have been available, but we need to continue prioritizing those efforts. And then one of the other things that we made a mistake on is that we had a great infrastructure already set up across this country. I mean, Walgreens is here in Lake County. And so we have 39 Walgreens locations. Is that in the future, I would hope that we're going to use that infrastructure to immediately starting to vaccinate our population. That structure already exists. It's there. Jewel Osco has 18 sites, CVS 29 sites. So we already had the infrastructure, but it wasn't utilized properly in the start of this pandemic. And then another thing for businesses is that we need to assure our long-term care industry is better prepared, because as going back to that death slide, is that 86% of our deaths are 60 and above. What we found is that our long-term care industry really was not prepared for pandemic. We did not have the appropriate PPE, infection control, nor were we set up to immediately vaccinate that very susceptible population. So just to demonstrate, the value of vaccinations is that this is brand new data from December 2021 as to January 17th. And so you can see that the majority of people, and Jeff's going to talk about this, is that the majority of people that have been hospitalized of late after the vaccinations were available are those that are unvaccinated. So you can see the darker bars are individuals of late that were unvaccinated. And then you can see that there was the other orange bar was individuals that were booster eligible but had not received their booster. As you age, those individuals were more apt to be hospitalized if they became infected with a crossover or breakthrough case. And then we had very few that were fully vaxxed or boosted that were in the hospital. So unvaccinated people definitely have been most likely to be hospitalized in all age groups. And so we do want people to definitely get boosted as soon as they can, just for any other potential variants that are coming forward. And one of the other things that, pandemics, meaning all people, is that we need to continue making sure that the rest of the world is getting fully vaccinated. Only 5% of people in low-income countries are fully vaccinated. And so you can see Africa is really, really limited as to the number of individuals that are fully vaccinated. So we need to continue that. Russia, as you can see, only 48%. And these are very large countries with millions and millions of people. And the last thing we want is for this virus to continue to mutate and to go into a different variant type that not only may be more infectious, but what may be even worse for the United States is if it's more virulent. So one of the other things that we need to really assure next time that we do a better job on is to have testing available. Many other countries were way ahead of us on having testing almost immediately once COVID-19 was identified in their countries. Again, another positive is public and private partnerships. CDC had a very challenging time getting their tests out. And then they ended up contaminating their tests. So early on, as you probably remember, we did not have testing in the United States until the summer of 2020. So it was multiple months before we had any quantity of testing. The other thing that we did was we didn't really stockpile testing components. We didn't have the right swabs. We didn't have the right sticks. We didn't have the right reagents. And we were relying on international supply chains that were already being impacted by the COVID-19 pandemic. And also, we didn't use, again, existing infrastructure immediately in the future. We weren't using LabCorp and Quest and other laboratories to really do this. It was all being done in government labs or in other labs that were not able to scale up. And then we also should look more at our global partners, Germany, South Korea. They already had accurate testing methods, and we didn't adapt and replicate them. Then technology. I mean, I think this is something that, again, we failed pretty miserably on, is that we have so many diverse and systems that are really not interoperable. Is that CDC was requiring data to be put into their system in a certain way, and hospitals and other entities had challenges doing that. And so we really needed to have a better public-private partnership and not rely on, the government to create these systems or to report into a system that your system doesn't know how to talk to. And I think one thing about health and healthcare that, all of us have a Social Security number, is that the financial banking system knows every transaction that we make financially. And so everybody, there's a system that the whole United States uses that's connected, but we have nothing like that for health data. And so when new infectious diseases come, we're not able to quickly see, that cases are growing, or that there are other issues that may be leading us to believe that the COVID-19 virus, as an example, was already in country for a month or 2 months before anybody had even identified it. And so we need to have a better infrastructure, and to create something like a national health information exchange, like countries that have different healthcare systems than we do. All that information is going into one system, but how could we have all of our health system data going into a system in advance without trying to put it together once we're in crisis? And again, we need to look to global partners to really look at successful technologies that worked well for them. And I think one of the big challenges that we had here in the United States is really ideological rigidity. And I'm not just talking politics, I'm just talking many ideologies that we may have individually or as communities, is that we did not have really clear and accurate pandemic communication. And so we know that science will always evolve, but we have to pivot faster. We have to communicate that science faster. And then there was a lot of messages that got politicized that caused fragmented and varied pandemic response. So on one hand, you would hear from the federal or state government one thing, and a couple months later, you'd hear the exact opposite. Now, science does change, and that may have led to a different piece, but a lot of those messages were political in the beginning, and then so they had to go back and say something totally different because the original political message was not accurate or based on science. Also, what we found during this pandemic is that countries that rode together, that where the communities came together, worked together, they were much more successful in their pandemic mitigation efforts, and ended up not having to lock down their communities or do different things because they were already all working together in a more community way. And one big issue that causes problems now with regard to supply chains is a lot of the things that we did in the United States impacted other countries. So, for example, those of you that may be in retail, in clothing and garments, is that when we locked down and people were not going out and shopping at our malls and our stores, buying clothes, that affected Bangladesh dramatically. Is that because those individuals that make our clothing across the world, that they were not able to have orders coming in. So they work by piecemeal and they get paid by the piece. We were not ordering as many new shirts because or ties or dress slacks. And so what that actually happened or occurred is then it affected their supply chain of what they were making, and also caused severe poverty and other unintended health outcomes in that country because we were not buying the different things that we normally did. So with that, I just wanted to open for questions, and I will just say with that last bullet, we can and will do better next time, right? So that is where I will leave it, and I will pass this now on to my esteemed colleague, Dr. Kopin. He and I and Lake Forest Northwestern Medical System work very closely together and have worked very closely together during COVID-19. They've been a great partner and have done tremendous work for our community. So Dr. Kopin.
Thank you, Mark, and good afternoon, everybody. It's my pleasure to represent Northwestern Lake Forest Hospital and the Northwestern Medicine healthcare system today with our local chamber. So, talking about 2 years of experience in a hospital during a time where we were dealing with a disease that we did not know existed, literally little over 2 years ago. My first meeting to deal with what we now know as COVID-19 occurred on February 4th, 2020. We did not know what this disease was. We understood very little about it. We knew there was a problem in China. We knew that there were warnings coming from the World Health Organization that we were about to have a pandemic. And that's about all we knew. When I think about what happened between that first meeting in the beginning of February of 2020 through the end of March, it's really breathtaking. The very first patients that presented to us at Lake Forest Hospital with COVID actually were returning from ski vacations, many of them from Europe, European ski resorts, and some coming from Colorado and Wyoming. These were the first patients we saw. And you should know that the joke among my emergency room colleagues was that this new disease is a disease of the affluent, people who can afford to go to these ski resorts. We knew that that isn't what was going to happen because pandemic disease always hits those people who are in lesser socioeconomic positions than those who are in the higher. We did not have testing. We were concerned very much about personal protective equipment in the beginning, and you all recall those days. When I look back now over 2 years, I will tell you during the 4 major surges that we've had so far of this virus in its various forms, we have gone from not really knowing how to treat our patients. I'll be honest, in the beginning, starting in March of 2020, with our first patients, we weren't sure what to do. And we literally learned every single day how to better take care of our patients. I used to have a meeting every day at 5:15 with the medical director of our intensive care unit and the medical director of our hospitalists, literally talking about what we learned during that day, most importantly from patient care, the patients that we were responsible for, plus conversations that we were having with our colleagues, not only within our Northwestern system, but throughout the country and indeed the world. We rapidly understood that some of the original considerations that we brought to our patient care was wrong, and we had to change, and we did, and we learned. When I think about where we were back then in March of 2020 and where we are today in January of 2022, the progress is truly breathtaking. Although our death rates in the country is still way too high, we're still losing over 2,000 people a day to COVID in the United States. Our ability to support people through their illness in the hospital is absolutely extraordinary. And that has to do with amazing work done by lots of physicians and scientists all over the world. And I'm very proud of many of my Northwestern colleagues who've been at the forefront of these new advances in the care of patients with this disease. I agree with Mark that the vaccinations is just an extraordinary achievement of world historical importance. To think that the first sequencing of the genetics of this virus occurred in early 2020, and by the end of that year, we were already able, by December of 2020, to begin to vaccinate. That it's amazing. That is absolutely a miracle as far as I'm concerned, and it's one of the greatest achievements in biomedical science in history. It's absolutely amazing. And I will share with you that for me, in a career now that is now 42 years in medicine, the very greatest day in my life was the very first day that we started to vaccinate our colleagues here at Lake Forest Hospital, our front line medical staff, physicians, nurses, respiratory therapists, environmental services people, and so on. That day was amazing. The amount of tears that were spilled that day was extraordinary, and it was reflective of the commitment that our staff has to take care of our community. And that's what I want to talk a little bit about right now, because I think this is similar to what many of you have experienced in your own businesses. This has been such a difficult 2 years. We've had such a difficult time not burning out. We've been at this for 2 years without a break. And for our frontline staff, and I'll just talk about our nurses, think about being a nurse with small children at home who are of school age. You're not sure if they're going to have school or not. You're supposed to go work a shift, taking care of very ill patients, where you're still concerned, even though our PPE has done such a great job, that there's always that possibility that you yourself will get infected and you're going to bring it home. That's been going on for 2 years. We have had about 25% of our total workforce leave. It's very difficult to replace these people. And that's caused amazing challenges for us. And I'm sure in your own businesses, you can tell similar stories about the difficulty of finding staff to come work with you. We've been able to be very flexible in the way that we use our staff. We've been very flexible in the way that we've been able to use staff between our different facilities. You should know that we've, on multiple occasions, pulled staff from our clinics to come help out in the hospital when that demand was there. I see this as a continuing problem going forward. And as a medical community, we're going to have to be able to deal with the fact that so many of our staff are going to have lasting negative impact from the experience of the COVID pandemic. We are doing a lot of things to try to help our staff, but these initiatives are going to have to continue for the foreseeable future, and I actually think beyond. One of the questions that comes up all the time is, where is this going? And Mark and I haven't talked about this lately, but I hope, and I think there's good evidence, that Omicron, as infectious as it is, likely will get us out of the pandemic phase. I think we're well on our way to seeing this coronavirus becoming endemic. As Mark explained before, it's just going to become part of the background virus that we have to deal with, but it will no longer be pandemic. 2 years ago, none of us had any immunity whatsoever to this virus. How could we? This was a novel coronavirus, never existed before. Humanity could not have immunity to it. What's happened over the last 2 years between natural infection and then the vaccination is our population has been gaining significant immunity to this coronavirus. And the hope is that that significant immunity will help us get through the pandemic into a more endemic time when we can get back to living our lives in a more normal way. And I think, Joanna, I'll conclude there. And Mark and I would be more than happy to entertain whatever questions the chamber has.
First of all, I can't thank you both enough for this presentation, because you gave us such a fabulous overview, Mark, and And Dr. Kopin, giving us that kind of background on the challenges and also the trajectory faced by the hospital is enlightening for all of us, because you are paralleling some of the experiences that the businesses have had, which you mentioned. And I can tell you that many of the questions that have been posed have been answered. I do have two that I wanted to offer up. One is, do you feel that the issues at the pop-up testing sites might have been the cause of the uptick in COVID cases? And I don't know which one of you wants to take that one on.
I'll be happy to take that one on. And so, no, actually the uptick of cases really relates back to what Dr. Kopin just said, is Omicron is so infectious. And then the timing of Omicron was right during the holiday seasons. So we had Hanukkah, we had Thanksgiving. I mean, so a lot of people were getting together. And so because it is so infectious, that's where we started seeing those cases grow. And then there was a lot more testing, so that was helpful. But again, many of those tests were being done during this time at home, and those tests are not counted. But this was, as Dr. Kopin said, and Jeff, I do agree, is that one of the helpful things about Omicron, I mean, unfortunately, there's still people that were hospitalized and died because of it. But ultimately, that's leading to greater natural immunity. So that goes to that herd immunity concept that I put out there. But there's other issues that have happened at the pop-ups that may have actually done some negative things. So some of the tests have now been found to be fraudulent at some of the fly-by-nights. And so there may have been tests that are coming out that, were positive that, were being deemed negative, or vice versa. So I think there's other issues that happen because of the pop-ups.
Yeah, Mark, I want to add on a comment you made before about testing. Our FDA has to learn a very important lesson about the process of approving diagnostic tests. Mark and I know that putting together PCR tests for this coronavirus is actually a relatively simple process for diagnostic laboratories. There's nothing novel about it. It did not require any kind of scientific breakthrough. As a matter of fact, my laboratory colleagues at Northwestern Memorial downtown made their own test, and they weren't allowed to use it. And this was true all over the country. When we finally have the reckoning, and my own hope is that we have the equivalent of a 9/11 commission to look into this, trying to keep the politics out as much as possible. As difficult as that's going to be, and I actually would nominate my friend Mark Pfister to be the head of that committee. He would do a very good job. We need to learn lessons, and one of those lessons has to do with diagnostic testing. It really handicapped our ability early on to properly take care of this. Mark and his team tried so hard to do contact tracing in the beginning, which is the classic way of doing disease control. We couldn't do it because we didn't have testing. It would take weeks to get tests back from the state of Illinois. So that's one major issue that we need to do better next time. And I believe we will. I think we'll have the flexibility to innovate quickly and be able to bring out diagnostic tests should we have another viral pandemic in the future, which unfortunately is probably inevitable.
A few more questions are popping up. And you know what? I personally am so grateful for the thread of optimism that is running through both of your presentations and your responses. So thank you for that. A couple of other questions. One is, we talked about the percentages of those who have been vaccinated, and we just now heard about the numbers who have been exposed to the virus variants. What would be the additive values that would move us toward herd immunity?
Mark, I'll give that one to you. That's an ecology question.
Yeah, can you repeat that one more time?
Sure. We talked about the percentages of those who have been vaccinated and heard about the numbers who have been exposed to the virus variants. What would be the additive values that would move us toward herd immunity?
Yeah, actually, they are additive. So, that's where I think Jeff and I are saying is that with so many people being infected with Omicron, you have that additive value of natural immunity on top of individuals that were vaccinated. And then we also know through research is that people that were vaccinated and then ended up having a breakthrough case, they have even a higher immune response or antibody content than others. So, I mean, we don't want people to get sick. We want people to get vaccinated. But that's why we know with the boosters, especially people that have underlying condition or are more senior, is that's where getting that extra jolt, get your antibodies revved up. Because really all a vaccine does is just tells your body, as Jeff said, is that when the pandemic came, nobody had ever seen COVID-19 or SARS-CoV-2. And so we didn't know, our body didn't recognize it. So that's why many people got ill very quickly and it spread very quickly. And that's the other problem with COVID-19. It's the asymptomatic spread. Flu is when you get flu, you tend to be very symptomatic. You know you're sick. You're not going to go out. Problem with COVID-19 was people were walking around asymptomatic, not knowing they were passing on. So it was a very difficult fight. And then without testing, we're not able to know that. And so I think this is where natural immunity is a benefit on top of the vaccination immunity.
We have a couple of questions here that are about practices. And let me ask one more about research here. And that is there any research about the impact of daily exercise on fighting these variants? This particular individual works in the fitness industry and exercises 6 days a week. And as far as they know, they have never gotten sick and have never had a test for COVID.
Yeah. Well, first of all, congratulations for exercising that much. I wish all my patients would listen to my advice when it comes to that. To my knowledge, there has not yet been a well-done study looking at exercise and this infection, although I know that there are some of those studies ongoing. What I can tell you in general, there have been many studies done over the years looking at our immune systems in people who regularly exercise compared to people who do not regularly exercise. And we know that there are only good impacts on our immune systems when we exercise. Physical activity does so much good for us. And included in that list of good things is a wonderful impact on the immune system. So I would recommend to everyone that you get exercise. It can only help. As an internist, I would tell you it will help you in every way. Mark and I have talked about the problems of hypertension in our community and diabetes in our community, and we know exercise will help with those things. And as a quick aside, one of the things I was concerned about, and our fitness person on the call will appreciate this, when we had the original lockdown and people were told not even to go outside, and that happened not in every community, but it happened in many. That was such a mistake. People need to get outside. People needed to get outside and get exercise of some kind. It was no good to keep people locked inside without any ability to get outside. And I hope that's another one of the lessons that we learned from this experience.
Jeff, let me ask you this too. I'm going to combine a few questions here, so apologies to those that are asking them. But one question is, how often can we get a booster vaccine and when? Also, what would the recommendation be for autoimmune or compromised people?
Yeah, let me start with the second part of the question because I can be more explicit. Depending on somebody's immune deficiency, some people are going to need to get ongoing, not only boosters, quite frankly, it's just part of their basic vaccination course, depending on what that immune deficiency is. So for example, our patients who have had solid organ transplants, be it a heart or lungs, kidneys, these individuals are going to have to continually get vaccine as long as we have a pandemic level of this virus around. And all of our transplant patients have been instructed how frequently they should be coming in. Individuals who don't have that kind of immune deficiency, but an autoimmune disease, people who might be dealing with cancer, they really need to speak with their physician about what the recommendation is, because each disease process, each immune deficiency is going to have a different recommendation. We're getting better and better at this and making those recommendations. The bottom line, though, is if someone does have one of these chronic illnesses that leads to a immune deficiency state, they need to be very certain that they stay up to date on vaccination. Don't even think about it as boosters, just think about it as your primary series of vaccinations. Now, for people who don't have those issues, now we're getting into uncharted territory. And the truthful answer is we don't know yet how frequently we're going to need to get vaccinated. And I would just state too, anytime anybody answers any of these questions with certainty, don't listen to them. If there's one thing that Mark and I have learned with our colleagues, it's humility. This virus keeps surprising us. Whenever we think we really understand it, we don't. So we have to be very humble. And by the way, that would be my message to some of our national public health people. Learn some humility. Don't be on TV every day. People are going to turn you off. Mark talked about that a little bit in his slide. And I'll tell you, we're very fortunate in Lake County that we have Mark as the executive director of our health department, because he understands this, and his communication has really been right on. And I'm very appreciative for the efforts that have come from Mark and his colleagues. So we're following closely a place like Israel right now. Israel is giving a fourth vaccine now to its entire population over the age of 12. And we're going to know probably by the early spring what the impact of that fourth dose is. We don't know yet. So we'll see. I also will say that there's some basic science that would caution us about too many vaccines, that there actually could be a blunting of the human immune response. So that's something that's being watched very closely by basic science groups around the world. So I suspect that by the time we get into the spring, we're going to have much more information to be able to answer this very important question. And one more thought. We should all expect, just like we get an annual influenza vaccine, right, for the seasonal flu, the fall, the winter, hopefully all of us are getting that shot. It's very important that everybody does. I fully expect that we're also going to be getting a shot directed against SARS-CoV-2, the COVID-19 virus. Right now, Pfizer just started a clinical trial, a vaccine against the Omicron variant of COVID. Pfizer changed the recipe for its mRNA and was able to quickly come out with a new vaccine. Pretty amazing. That clinical trial just started. We should get their data sometime during the spring. The irony, of course, is this wave of Omicron will be gone by then. But this is a proof of concept for Pfizer and BioNTech, its partner, which is very important because I think this will help us going into the future in thinking about vaccination, what type of vaccination we should be getting, and how frequently.
We have some fantastic questions coming in. Let's turn, if we could, a moment to any recommendations about isolation. There was one individual who asked whether they should continue to isolate elderly clients who have compromised health. So that's one question. And then we have questions about what the recommendation is now for in-person meetings, large groups, and also eating out at restaurants and banquets. Take it away, gentlemen.
Mark, you want to go first?
Yeah, I'll go ahead and start on that. Is that I think, we still, as Jeff said, is that, outdoor events, what we do know very clearly about COVID-19 is that it loves indoor congregate settings where people are very close to each other, unmasked. That's where we see the super spreader events. So I think, minimizing, outdoors, we know, and that was a very unfortunate thing, is that we know that it wasn't spreading. Another unfortunate thing is we know that COVID-19, they spent a lot of time thinking that COVID-19 was like the flu and that it was, you're getting it off of surfaces. So a lot of time and energy was spent on cleaning, doing things unnecessarily. But we know that if you're in close proximity with somebody who's infected, you're unmasked, you have a greater risk. So again, I think maintaining social distancing is still prudent. Wearing a mask is still prudent. Washing your hands is still prudent. And then for those that are immunocompromised or more elderly, I would just make sure that they are, we also know that there are behavioral health issues that are coming because of the COVID-19. We want to make sure people are still socializing, but how can they do that safely? So an immunocompromised or more senior person, we would recommend that they're wearing a better mask, a KN95 or an N95 mask, just something better than a cloth mask, and keeping individuals farther away from them.
Mark, if I can interject a moment, there was another question about masks. You mentioned the N95 and the KN95. How long do you think we're going to be wearing masks, and what about the rest of us? Thoughts on that?
Yeah, again, I think this is where, was another mistake is that, going back to the exercise question, I mean, I've run outside throughout COVID-19 without a mask, and I have not tested positive for COVID-19. So I think it really gets into what type of situation you're in. If you're outdoors, you may not need to wear a mask or just a cloth mask if you're going to be around people. I think it gets into the questions of ventilation and knowing your bubble. I think this is another big factor. I mean, if people have been tested recently, that they're taking precautions, then you may feel more comfortable wearing a cloth mask or no mask around those individuals. But I mean, ultimately, if you don't know who they are, you're in, I watched the football games last weekend, great football games, but there's 70, 80,000 fans screaming and yelling. I'm sure there were people that got infected, at those stadiums because they didn't know who was nearby them. So I think, restaurants, are safe and lower risk. If you're eating at a table with people that and the ventilation is good. And I know a lot of restaurants did a lot of good work of social distancing, making sure the tables weren't right on each other, keeping people from congregating at a bar. And I think that's with alcohol too, is that, when people start drinking, the first thing that goes is judgment. And so I think that's another factor in it, is just, trying to be as safe as possible. We're not going to prevent all risk. But I mean, look at the situation you're in and make a determination on what risk you're willing to accept. And I think we're getting to the point now where, we as government aren't going to be telling everybody what they should do or not do. And I think this comes down to personal responsibility and understanding we all know what the risks are with COVID-19. Very infectious. How do we minimize our risk is something that we all need to think about.
Yeah, I would add on to this, and I think this is really good advice to everybody. My wife and I eat out in restaurants, and we're very happy to do that, and we're really happy to support our local restaurants. And I'm a really big tipper, I want you to know these days. We got to take care of our people. At the same time, everybody's got to make the right risk benefit calculation. Everybody. My wife and I are both healthy. We're still relatively young. We're fully vaccinated. We feel comfortable going out. That's not necessarily the fact for everybody. My mother, who's older, she's spending the winter in Florida, so I don't have to worry about seeing her and bringing the virus to her. So everybody's got to think this through for themselves. And quite frankly, the answer is going to be different for everybody. And that's okay. I mean, that's okay. And just use your own judgment. People need to be informed. I think we all are, and we need to make our own judgments. One other thing about masks, don't be surprised that you're going to see people wearing masks for years now. There are going to be people who choose to wear masks, particularly in the fall and winter. They've been doing it in Asia since the first SARS virus in 2003. For people who choose to do that, that's great if that's what they want to do. When you come into my emergency room in the fall and winter, I fully expect my staff will choose to wear masks because they're exposed all the time, not just to not just to COVID, but also to influenza, RSV, all these other lovely respiratory viruses that are out there. And that's okay too. So this is going to be an evolving thing. And I think, Joanna, the bottom line in all of this for everyone, we have to respect one another. And when I see some of the fights that go on and the lack of respect between people, let's just as Americans, people are going to make different decisions, and that's okay. We're at the point now nationally that we're over 2/3 of the population is now vaccinated. That's fantastic. I never would have guessed that we would have agreed to do that as a country. So let's be respectful to everyone. Everyone make what decisions are best for you, and we'll continue to get through this. And hopefully we can see that glowing light at the end of this tunnel, which I do think is getting brighter and brighter.
Jeff, thank you for that, because I can tell you that many people on this call, and we have well over 100, many people on this call are the front line when it comes to frustration and people's impatience in wanting things to come back to what we knew as normal. So thank you for that. We are going a couple of minutes over. I hope that's all right. For those that want to stay on, I'm happy to share a couple more questions here. One is regarding the J&J vaccine. There are two questions about this, and that is that regarding the Pfizer and the Moderna boosters, Jeff, with those who had the J&J injection. So if you could just address that for a moment. There were two questions on that.
Yeah, someone who got an initial injection with J&J, which is fine. There's good protection. When they get their booster, it should be an mRNA vaccine. That's the recommendation that came out of CDC. I think it's a good one. I actually I was counseling my J&J patients to do that even before, and get the mRNA vaccine, either Pfizer or Moderna.
And then just
Either one. Okay.
Yeah, and so just to tap onto that, that is our recommendation too, is from the Lake County Health Department, is that if you did get the J&J, good vaccine, but getting the mRNA, either a Moderna or a Pfizer. And just the other thing too is that, I mean, we are having individuals that maybe they got the Pfizer, first series, and then they got a Moderna booster. I mean, that's another thing that you can now do. And also boosters, both Moderna and Pfizer, are available 5 months after your second dose. So that's a new change rather than waiting 6 months. So if you were waiting 6 months, don't have to worry about that anymore. Wait 5 months and go get your booster.
Good news. Here's somebody who said that they had COVID in November of 2020, and they still have no taste or smell. It's been 15 months. After vaccinations, he actually now has parosmia. I'm not sure. I'm not familiar with that. But any studies on the long haulers and what they need, what they will be facing, Jeff?
Yeah, so there are a number of COVID long haul clinics that have now been established around the country, around the world. We have one at Northwestern. We now have, last time I looked, it was over 700 patients in our registry locally, just with Northwestern, who has some type of long haul symptomatology from COVID. Somebody who's gone that long now without their taste and smell, that really does put you in an extreme group. Thankfully, most people have gotten their taste and smell back, but we are still optimistic based on other viruses that have caused a loss of taste and smell, that your taste and smell will come back. It might take a few more months, maybe even another year, but once we get out 2.5 years, most people seem to get their taste and smell back. So there'll be a lot written by these long haul COVID clinics about what we're learning, who the people are who are at risk, what we can do to help people who have ongoing symptomatology. And I do want to stress to everyone, this is real. There are plenty of people out there who have some element of long haul symptoms from this virus and their body's response to it.
There are a couple of questions here, quick ones, but one of them, Mark, is regarding statistics. Do you have anything ready as to how Lake Forest and Lake Bluff are doing right now?
Absolutely. They can just go onto our website to the Lake County Health Department's data hub. And maybe I'll drop that into the chat while we're asking the next question. And so 60045, I believe, is Lake Forest. And
Yeah.
so right now you're a little below the Lake County average for the incidence rate, which is the new cases per 100,000. So it is dropping. So that is good news. And I will just drop that URL into the chat.
Yeah, and Joanna, I would add, just from a hospital standpoint, today we have exactly half the number of COVID positive patients in our hospital in Lake Forest than we had 3 weeks ago.
That's great.
That's a delightful piece of news for me to share with everyone. We're still very busy. We take care of the whole community. Not everybody has COVID. All the other diseases are still there, but we've learned how to do this. Take care of everybody. And, I think that's another thing, Mark, that we really should stress to everyone. As busy as our hospitals got, we never got overwhelmed. When we were concerned about ventilators, we figured that out. Thankfully, that wasn't a problem. We've been able to deal with the bed crunch. It's really amazing how our local hospitals have been able to band together to take care of the whole county. And it's something we should be very proud of. We've learned a lot. We coordinate our efforts. There's a lot of cooperation, more than I've ever seen in my career. And that's something I'm very, very pleased about.
Well, gentlemen, I can tell you that I have all of these messages of gratitude here that I just wanted to tell you are just flowing from our attendees. And, here we have a state-of-the-art hospital, and we have the two of you at the helm of what we are relying on. And I can tell you that this has been so informative. And honestly, it does infuse us with optimism going forward. And we need to look at it that way. We all need to be resilient. We need to be optimistic. And as a Navy SEAL friend told us, we need to assess, strategize, and execute in order to keep it moving forward, right?
Yeah.
So I can only say that this has been outstanding. Mark, thank you so much for that link. And what we will do is we will shoot that to everybody. We'll send a communication to everybody and send that link so that they can take a look at what the health department has up there, including the stats. And I cannot thank you both enough. Any last words before we go?
No, just everybody take good care. We're 2 years into this. Everybody knows a ton about this disease. Let's live our lives in a responsible way, and let's just keep moving forward together.
And I totally second that, Jeff. And again, I think this is where collaborating together, cooperating, and thinking about how we move forward and how we move forward safely is what we need to do, and to prepare for the future and invest in new systems that get us to a better place. And also just with the businesses, hopefully some of that work will be funded back to you to help us solve these problems that we identified during this COVID-19 pandemic. So thank you all. Appreciate it.
Thank you.
Thank you. And take care, everyone.